Thank you, President Schmidt. And yeah, it is a privilege to introduce Dr. Eli Capilouto today because I am a true fan. I first met Dr. Capilouto soon after he arrived at the University of Kentucky and heard him speak several times. And he was impressive. His vision, his style, and his background prior to coming here, it was all very promising. And since then, over the years, he has delivered. So yeah, it's nice to introduce him today. Dr. Capilouto became the 12th president of the University of Kentucky in July 2011. Under his leadership, UK has grown and transformed in a whole lot of ways. One obvious visible example is the more than $2.6 billion transformation of the campus, aimed squarely at expanding UK's education, research, service, and healthcare missions. During the last 8 years, UK has opened literally dozens of new research, teaching, medical, and residential facilities, and renovated and expanded dozens more. Visually and aesthetically, the transformation of the campus over the years has been stunning. On top of all of that, the university is garnering about $430 million now annually in research dollars. Dr. Capilouto is a native of Montgomery, Alabama, and previously served as provost of the University of Alabama, Birmingham, and dean of the UAB School of Public Health. Dr. Capilouto holds several undergraduate degrees from the schools within the University of Alabama system, a doctorate of medicine and dentistry from UAB, and a doctorate in health policy and management from Harvard University. So, Dr. Capilouto, welcome back to the Rotary Club of Louisville.
Dan, it is great to be with you, and thank you for the kind introduction. When I arrived at Kentucky, today, I'm still a work in progress, and Dan was one of those people that helped me better prepare for the role that I've played here. And so I thank him for the kind introduction and the advice he gave me early on. It is a pleasure to be back with all of you, especially in these challenging times. I know you have never abandoned your commitment to service, and that parallels the way we feel at the University of Kentucky. So I thank you for all you do. And it is an honor for me to share with you some updates about the University of Kentucky, or what we like to say, the University of, for, and with Kentucky. Our mission has never been more important than now: our teaching, research, service, and healthcare. And as a world and as a state, and I tell our campus frequently, we're facing twin pandemics. One that can poison our lungs, and another that compromises the way we see the world through our hearts and minds, and that's the racial inequality. So I want to spend a few minutes talking to you about how we're meeting this moment, how we're maintaining our fidelity to that original mission, but certainly responding to our time. And it creates incredible opportunities for us and the communities that we serve. So first, I want to talk about our response to the COVID-19 outbreak. I remember I was in California last January. I read an article in the Wall Street Journal about the first few cases of COVID-19. I sent a text to my office. They were 3 hours ahead of me, and I said, if we haven't stood up our emergency operations center, which is the way we address things like this, we need to do so and go through some desktop scenarios, because this is worrisome. We stood that up. That has been the way we've addressed things, and we've been entirely responsive. I tell our team every day, we're going to be defined years from now by how we answered the question, did we care? And when we had to go to, the real shutdown in March, which I applaud the governor for his leadership, we had to keep our essential employees on campus, on the front lines. We had to stand up a daycare center, for instance, because all those had been closed. Early on, when the model showed that we possibly could not flatten the curve and would not have enough capacity for the patients that would be hospitalized and need intensive care treatment and all, in a 2-week period, we stood up a 400-bed hospital in our Nutter football training facility. We had to send all our students home, but we had to remain connected. We had people come together, call all 30,000 students, record, these are written responses or typed responses, of all of those students to determine what they needed, how we could best serve them. We certainly recognized we had to close the digital divide. We have an iPad program. Last 2 classes at the University of Kentucky, everybody gets one. But there were students who did not have them, so that they could keep up. We mailed out a few hundred of those, and then we had to have Wi-Fi hotspots that we got out. Thanks to our federal delegation, the CARES Act provided some $9 million that we were able to direct immediately to students in need. We began immediately thinking about how are we going to restart our campus. And we certainly knew we had to restart our healthcare enterprise. We had stopped all elective procedures to build capacity. That was the first phase that opened. We opened some of our research enterprise, athletics, and we learned from each of those subsequent, each of those reopenings as we thought about how we would reopen in the fall. So one of the things we decided, based on the experts in epidemiology and infectious disease, that we would test every student for COVID when they arrived on campus. Not too many universities did that. It wasn't really recommended by the CDC. They focused more on symptomatic patients to test. But when we were bringing 30,000 students back to campus, we felt a responsibility, and they come from all 120 counties, 50 states, and 100 countries. We felt a responsibility to our local community and the Commonwealth to understand what kind of infection rates we had. We also implemented a daily attestation. I fill out mine every day, check on my symptoms and all, and if I need to be seen quickly to check me for COVID, that testing can be arranged in minutes. After 7 days of testing, we did an analysis and decided there were other groups we needed to test again, and we've certainly done that. But what has been, I think, a differentiator for us is 4.5 years ago, we developed a relationship with Salesforce, which is the largest customer management relationship sort of software in the country. I think they just went on the Dow Jones Industrial Average. It's an incredible company. We had a partnership with them to help us improve student success. But because of them, we were able to build a platform where all this testing, attestation, this data comes in quickly. If you're positive, we can quickly determine where you live, who may be around you, do the contact tracing, do the interviews. People that need to be isolated, we're going to get them in isolation. People that need to be quarantined, into quarantine. We're going to provide all the services in you where you stay in place, from food to coursework materials you may need and all, to stop the spread of this disease. So that has been important to us. We then determined that we would open our campus and take advantage of that $2.6 billion we spent in modernizing our campus. It was easy for us to put one student in one bed in one room. I read today in the New York Times, those universities that have had to close, didn't have the newer facilities. Our physical space made it a little easier to be safe. We moved some 9,000 pieces of furniture to make our classrooms have sufficient distance where students could be seated and faculty could teach. We also installed in every classroom, nearly every classroom, the technology so that if if you had symptoms one day, you thought maybe you could be coming down with COVID, or you were in isolation or quarantine, it is possible for you through our two-way communication to attend that class. Every classroom we wired that way. Our students remain at the center of everything we do, and I feel good about our enrollment, that all that we've done in COVID and our other improvements over the past several years are best reflected in a record enrollment. For the first time, the University of Kentucky has exceeded 31,000 students. And our freshman class is down a little, which we expected. So you might ask, how did our enrollments go up? And this is the most gratifying part. The reason is more and more students are persisting. Nearly 87% of our freshman students returned for their second year. We've gone up 5 percentage points in the last 4 years. I don't think there's any university in the country that has done that. And we're only a few percentage points of being in that, away from being in that top 150 universities, all 4,000 universities in terms of our graduation rates. That is a tribute to our faculty, to our student support activities, to so many invisible hands that take care of our students. We also have that success in a way that makes me proud. A lot of universities have improved their graduation and student success rates by becoming more elite, all right, and getting smaller. We did the opposite. We got bigger, and we opened our doors wider to Kentuckians, especially those from low-income families. 25% of all the Kentuckians that come to the University of Kentucky come from families where their annual salary averages $20,000. So you can imagine what kind of climate it is for those families. We've enjoyed success in those areas. We know if we can make possible a college degree for those students, it's transformative, not just for them, but for their children and their children's children. So that has been our North Star. It's a sacred commitment we have. Bring our students here, develop an environment of acceptance and belonging, strong academics, and get them to that day of graduation that means so much to their family. I also want to talk about diversity, our efforts there. All of us know the sort of stain and sting of racism, what it has meant to almost every community in Kentucky. You certainly feel it in Louisville. We have our own history at the University of Kentucky. Lyman T. Johnson, a native of Louisville, whose biography we distributed to hundreds of people this year. I read it. I didn't realize it existed. I was so moved by it, how he was such a force in Louisville, but he forced open our doors and made us take a close look at ourselves. And just 70 years ago, we have made progress. I'm very proud of it, but we have room for more progress. We're more diverse than any time in the history of the University of Kentucky. We graduate more students of color than any university or college in the state, and we've had a constant ascent over the last 9 years. Recognizing what we confront today as deep-seated, sometimes invisible, but recognized as systemic and systematic racism, we thought we had to have a powerful, sustained, comprehensive approach to this, that a simple committee or a task force working over a semester or a short period of time wasn't going to do it. We had to have a sustained effort. We wanted to involve the entire campus, and we used the same approach we used in tackling COVID, sort of the emergency operations center, where we put different work streams underneath to tackle all the facets that one must address to keep people safe. So we announced this approach. It's under our DEI initiative, diversity, equity, and inclusion. We had over 800 nominations of 600 people. We learned in COVID, big tent, big table, better ideas, more embrace and buy-in of what you're trying to do. So we've launched these project teams. Over the last couple of weeks, we'll announce more. They can get into talent, both at the student level, faculty and staff. Difficult issues on college campuses today about speech, appropriate speech, free speech. That's something we're engaging groups to discuss. But our work didn't start just on the death of George Floyd or Breonna Taylor. Our College of Education has been working for over a year, and we announced with the NAACP, and we announced the first for them, and what will be a groundbreaking collaboration to develop education and research initiatives on educational equity. We also, under the leadership of our Vice President for Research, Lisa Cassis, launched Unite. This will be a 5-year, $10 million initiative that tackles research around racial disparities and inequities across broad areas from healthcare to the historical underpinnings of systemic racism. We also stood up the Commonwealth Institute for Black Studies. We have a really top-notch group of scholars in that area. I think understanding our history, I think back recently, growing up in Montgomery, Alabama, a journalist wrote an article on what was my 4th grade civics book. And I remember what I was taught then, and thousands of Alabamians were taught really about a romanticized Civil War and the difficulties, the brutalities of those times just really weren't confronted. Our history has much to examine, and we want a means to do that in an objective, dispassionate way. Turning to service and healing. Since its inception, we have had within our DNA this commitment that I call our land grant or service to the entire state of Kentucky. We birthed a medical center a little over 50 years ago. That DNA of service exists there. I see it every day. In a little over 15 years, we have doubled the number of patients admitted to our hospital. It's well over 40,000. They come here for the most complicated and complex care. My predecessor, Dr. Lee Todd, I tip my hat to him, and Mike Harf, who is our Vice President for UK Healthcare, said no Kentuckian should ever have to leave home, regardless of how sick or seriously ill they are. And they turned that vision into a reality. Our record-breaking $430 million of research focuses on health disparities in Kentucky. Cancer, heart disease, diabetes, and obesity, neurologic disease. Those are the things that cut life too short for Kentuckians. They are our priority. And last April, UK was one of 4 states, or 4 universities in 4 states that received from the National Institutes of Health a HEAL grant. It's an $87 million grant where we made a commitment to reduce opioid deaths by 40% in 3 years. Certainly, this pandemic has had us working in ways we hadn't imagined. We remain committed to that. When you talk to leaders at NIH, they say Kentucky, with its 20 researchers from 7 colleges working across communities and with communities in Kentucky, are setting the standard for that research. So this is a distinctive time for our university. And when I spoke with my leadership team twice today, we have to meet frequently, ready to pivot on any kind of information. We reminded ourselves again, we're not just trying to survive, we're learning through this process so that we're going to thrive, not for ourselves, but for all of people like you and the many others across Kentucky that we serve. The education we offer students, the service we render in every county of our state, that research we conduct and the care we provide Those things have never been more essential to us and to Kentucky. We've been at this for over 155 years, and I've been here into my 10th year. More and more, I know we're not doing anything different. We're doing what every generation before us did in answering this call. I look back at our history too. The first president to live in Maxwell Place, where my wife and I live now, was Frank McVeigh. He was the third president. There's a wonderful biography I turn to every once in a while. He faced the Depression, World Wars and all. And what he wrote, 100 years ago resonates today. He said, as the years go on, the state university will become more and more important to the people of Kentucky because the people will need interpretations of social movements, knowledge, and understanding of the scientific investigation and discoveries, and the benefit of trained personnel to carry out the purposes of the state. In his words, he concluded that what will save this nation after the war are the universities. I hope we have met what he wrote some 100 years ago. We have a new and complex array of challenges. I'm confident as a university of, for, and with Kentucky, we will rise to the moment, and we stand ready to help you as partners and help our entire Commonwealth meet this moment. So with that, I'll conclude, and if we have time, I'm happy to answer some questions.
If you have time, Dr. Capilouto, we do have several questions for you. So
I'm not great in that chat. I may let you.
I'll ask them for you. I just want to make sure you have time to spend with us a little bit longer.
Sure,
okay.
I have time.
Wonderful. Well, I know this is on the mind of the sports enthusiasts, and we had Mike Mountjoy on earlier talking about the Louisville Football Club. We are having great success opening and playing here, and it's been a great model on how to do it. And just curious if there's any word from the University of Kentucky and the football season and all the rest.
Yeah, first of all, just like the University of Louisville, we work closely with the governor's office, our public health offices. We don't exist on an island. We are here to protect the community and open these kinds of things safely. So there'll be news coming this afternoon. It's a timely question, but I think if you certainly recognize some of the parameters other universities have worked within, we'll be working within those same guidelines.
Terrific. Kind of going forward with a partnership in the past several years and through the decades, there have been collaborative initiatives with the University of Louisville. What is the status of those efforts today?
First of all, I so enjoy working with Neely Bendapudi. She is a jewel for the Commonwealth, and I think we're most fortunate to have her. We certainly communicate often. Sometimes, it's not on major issues, but, individual things that we challenge that are common to our campus. Our provost and vice presidents for research frequently communicate. We collaborate on a variety of things. It's always a strong partnership, from an executive MBA program to writing supporting letters for joint research that we can do in serving the Commonwealth.
Very good. This is from a parent, from Todd Warren. He has 2 UK students, and he's curious about what data you look at to determine when it's safe for students to get back in the classroom full time. And thank you for everything you're doing.
Thank you, and thank you for sending your children to the University of Kentucky. So there's 6 or 7 things we keep our eyes on. We tested every student when they arrived, and that's a positive rate. Ours was a little over 1%. It's not practical. We don't have the supply chain for testing. It's not fully wide open, but we work on that. We have secured testing that we're going to need through the entire semester. Then we analyze that data quite carefully, see if we see any areas where we think infection is arising. We also look at, through our contact tracing platform, how quickly we can identify, we get the test as quick as possible. We talk to the individual and get them into isolation quickly. We do the contact tracing of all the individuals they possibly exposed, get them into facilities. All of that is a supply line issue, and you've got to have capacity in every one of those parameters to control this virus. So we look at that daily. I get a text message twice a day on testing and so forth. And then we have posted for everyone to see the same parameters we do. It's a couple of day lag. I hope people appreciate we want to scrub our data before we put it out there. So an example, through our testing, and somebody can go to their home county and get tested. That may take a while to get to us. We've made so much testing available because when you test on our campus, that quickly goes into our platform. We can quickly do the contact tracing, keep people safe. And I visited that group yesterday, 30 contact tracers working 7 days a week to keep that disease from spreading in any way. Also, you know, at the end of this, every day I check our hospitalizations. And I know Dr. Newman checks with our local hospitals too to make sure we have capacity. If you look at Kentucky's data, I think probably 25% of the people who have tested positive are under the age of 29. There has been one death in that entire group. And you look by age, because you have, you know, more risk factors and all, that's who you worry most about. We don't want our students spreading to people at risk. And God forbid, if anything happens, we want our hospitals with full capacity to be able to treat people. So I check that every day. So there are 6 or 7 factors that we look at.
Thank you, Dr. Capilouto. This question is from Joan Frey, and she would like to ask you about the changes in finances and how that may be affecting the retention of qualified faculty.
Yeah, so, you know, I think we welcomed, had to do it by Zoom, over some 200 faculty, new faculty. I'm proud to say it's the most diverse group we have. I think more people want to come to the University of Kentucky than leave. We are aggressive in how we retain the most talented faculty. And it's not just money. It's important for you to have a warm academic home and colleagues to work with. We pride ourselves in multi and interdisciplinary research. For instance, this new initiative that we announced, Unite, to look at race and racism. We had our first 2 town hall meetings last week. I think we had nearly 200 participants who are engaged and want to work together. I think researchers, scholars appreciate that kind of opportunity. So I feel good about it.
This question is from Jack Guthrie, and he would like to ask you what prompted your decision to totally reorganize your leadership staff.
First, we put students at the center of everything we do. And certainly COVID makes us all take a look at ourselves. I certainly looked at my office and the way I work and we work now and asked how can we best serve, starting with students, because no students, no faculty, no university. They're at the center of everything we do. One of the things I created was a vice president for student success. That individual was an associate provost. When I arrived here, there was a vice president for student success. In a previous reorganization, that moved to the provost. Having an advocate who's reporting directly to me about student support. This is not involving their academic components, which is strictly under the provost and the faculty. We have a talented vice president and Kirsten Turner. She'd essentially been functioning as a vice president, great team member, And I think it was important, as our SGA president told me when I conferred with her about this reorganization, I could not be more excited. This is the best news I've received in a long time. I mentioned in my talk our land grant mission. We're in all 120 counties. I'm reminded that we're not just the University of Lexington. We have to keep our focus on the entire Commonwealth. Nancy Cox, our Dean of the College of Agriculture, Food and Environment, has the extension operation under her aegis. And I felt it would be even more important in meeting our land grant mission that I brought her into an administrative role, quite part-time, when we develop a vision, strategy, goals, and objectives, to have somebody at the table who best understands the larger community in Kentucky. We had our first one-on-one meeting this week. She had a fascinating survey they conducted in all 120 counties, over 32,000 people surveyed, asking them what their needs were. The first one was well-paying jobs. That's what we need in our community, no surprise. But of the top 10, I think 5 of them are related to health or healthcare. I want affordable health insurance, affordable health care. I want access to health services. So, you know, that's the kind of information, a different perspective I have at the table. We strengthen the Office of the Vice President for Institutional Diversity, more resources, more responsibility, more opportunity to move the university. Also introduced what will be a senior advisor to me, Dr. George Wright, who is currently our interim vice president. Dr. Wright, native of Kentucky, graduate of the University of Kentucky, PhD in history from Duke, went to Texas as a faculty member, distinguished career as a provost and a university president. He's just added wisdom and great counsel, not only to me, but to others. So that's basically it.
Very good. UK has been at the spear in battling the opioid crisis that's really ravaged many counties and in Louisville as well. How is that going? Is there any new advancement with that?
Yeah, it's been several weeks since I spoke to Dr. Sharon Walsh, who is the principal investigator. I was curious, how do you adapt your studies, your interventions? Because so much of it was in those places where you can intervene, where users are, from needle exchange programs to those who've been incarcerated. And they have had to certainly shift the way that they deal with this. You may have seen an article in the Wall Street Journal, New England Journal of Medicine. We were one of the first to notice it because of the pandemic and the disruption and further stresses it puts on families and individuals who are battling this disease. We had an uptick in deaths. So our work is going to be harder, but we remain committed, and they've been quite innovative in the way they are tackling this anew.
This question is from Alice Bridges, and she asked, does the university model need reinvention to make the acquisition of a college degree more affordable and accessible? The current model seems unsustainable and leaves a lot of students in devastating debt and is simply out of reach for many others.
And she says, thank you.
Well, thank you for that great question. We've acknowledged that almost every day here. That's why we developed something that many universities are using. It's our LEADS program. And it's not just the scholarship we provide, it's shrinking the cost of unmet need. And that is the full cost of attendance and how much you have in grants and scholarships and reasonable loans. We know if we shrink that to less than $5,000, the likelihood of student success goes up. So we have redirected our scholarships, financial aid to close that gap. That means more individuals who have less means are included in our scholarship. So we're trying to address that in that way. The state of Kentucky has a performance funding model. There are 11 metrics on it. I think we're the only university in the last 3 years that has scored highest on 10 out of the 11. One year it was 11 out of 11. Some of those metrics include how your success with low-income students, minority students, students in the STEM fields, and we've been quite successful in that area. And we have sort of internally addressed the way that we educate students, and we recognize access and affordability has to be prominent on our radar going forward.
Thank you. This question is from Larry Sloan, and he says, you mentioned the issue of free speech. Would you please flesh that out a bit? For example, the balance between civility and free expression of incendiary opinions.
Yes. You know, I went to college during the Vietnam War era when free speech became an issue and any speech was supposed to be acceptable. And it's been interesting in my nearly 5 decades of being in higher education to see how this has changed not only on college campuses, but across our country. So we are committed to respecting the laws in the Constitution and the laws of the state of Kentucky, which has a pretty strong free speech statute. At the same time, we want to teach our students not to abuse that freedom. There's certain things that are said that are hateful and harmful. A real harmful part for me at a time when we need discussion, difficult discussion around some of these issues. Things that are said that just stop the conversation. So, you know, how do we have a code of conduct and respect for one another that really honors a precious right, and that's our freedom of speech.
Beautifully said. Thank you, Dr. Capilouto. And here's a question from Mac McClure. As a past member of the NCAA Board of Governors, what will be the outcome of Florida's law for college athletes to be paid for the use of their name, image, etc.?
Yes, the name, image, and likeness has become very topical at the federal level. There are a couple of bills that are starting to be moved forward. We're going to need some federal legislation because, you know, the Florida bill, the California bill, while their good intentions is to expand the rights of students to earn dollars on their name, image, and likeness, they also set up disparate competition, as you can imagine, which makes it difficult to, I think, maintain the amateur model in college sports. So we're going to need help from Congress. Also, you certainly learned from the NCAA that unless we get some preemption from Congress, which is really going to be hard in this political climate we're in, we face the adversity of significant lawsuits from individuals who claim they may not have been able to benefit from name, image, and likeness in the past. So these are serious issues, harder to address during a pandemic in a timely way, but they have real implications for college sports. I'm sure this is similar to the University of Louisville. University of Kentucky, we have 22 sports. 2 of them have positive net revenues. Football is the highest, and then men's basketball. The revenue over expenses in those sports finance the other 20. There are 100 student athlete scholarship in those 2 sports. There are 400 in the other. And this economic model is really built that way. And that gets fragile as we move forward with these kinds of laws too. I know Mitch Barnhart cares about as much about the women soccer team athletes as he does, you know, who may have 1,000 people at a game. than he does at a NCAA Final Four. Their lives are transformed by this experience too, and I hope we're able to preserve all this.
Dr. Capilouto, we've really asked you a lot of questions. Is there anything that we haven't asked that you'd like to share in closing, or?
When I used to take our daughter in the 1st and 2nd grade to school, right before she got out of the car, I would say, ask a hard question, which in time I regretted because she started asking me the hard questions. But I have to commend you on your good questions today. Thank you. I can tell you care about the University of Kentucky, and that means a lot to us.
Well, you know, UK being Kentucky's land-grant institution, your service and your success is so critical for the success and prosperity for the entire Commonwealth. And we just so appreciate your bold vision, your dedication, and most of all, your leadership. So I know all the folks on here, even though they might bleed red and some of us blue or some of us purple, Mike, at this time he's blue and purple being for the football club. But all of this, we just join together, and thanking you so very much for being with us today and for all you do for the Commonwealth of Kentucky.
Thank you very much. I'm honored.
So a reminder for those who would like to learn more about Rotary, please stay on the line, and we'll have our meeting immediately following. And we also want to share again, our speaker next week is Dr. Erica Sutton. Surgery on Sunday will be her topic. So thank you all so very much, and I hope you have a wonderful weekend. This meeting is adjourned.